Chickenpox, also called varicella, is a common childhood illness. It is caused by a virus known as the Varicella-zoster virus. Most children experience chickenpox at some point. While usually mild, it can be serious, especially for adults and those with weakened immune systems. Chickenpox is highly contagious. This means it spreads easily from person to person. The good news is that chickenpox is preventable. Vaccination is the best way to protect yourself and your loved ones. Chickenpox is characterized by itchy blisters that appear all over the body. These blisters eventually crust over and scab. Other symptoms include fever, fatigue, and loss of appetite. Although unpleasant, chickenpox typically resolves on its own within a couple of weeks. However, it's essential to seek medical advice for proper diagnosis and management. Chickenpox often announces itself with a signature itchy rash. This rash typically starts on the torso and face before spreading to other parts of the body. The rash progresses through distinct stages. It begins as small red bumps that develop into fluid-filled blisters. These blisters can be incredibly itchy, but it's crucial to avoid scratching them. Scratching can lead to scarring and increase the risk of secondary bacterial infections. Alongside the rash, chickenpox can bring about other uncomfortable symptoms. Fever is a common companion to chickenpox, often appearing before the rash. Fatigue and a general feeling of malaise are also typical, making it difficult for those infected to engage in their usual activities. Headache and loss of appetite can further add to the discomfort. It is essential to remember that not everyone will experience all of these symptoms. The severity can vary greatly from person to person. Chickenpox is highly contagious and spreads with remarkable ease. The Varicella-zoster virus responsible for chickenpox is an airborne virus. This means it can travel through the air in tiny droplets when an infected person coughs or sneezes. These droplets can then be inhaled by unsuspecting individuals nearby, leading to infection. Direct contact with the fluid from chickenpox blisters is another way the virus spreads. Touching contaminated objects such as clothing or bedding can also transmit the virus. Chickenpox spreads most easily in crowded settings like schools and daycare centers. This is why maintaining good hygiene is crucial in preventing the spread of chickenpox. Frequent hand washing with soap and water is one of the most effective ways to eliminate the virus from your hands. Covering your mouth and nose when coughing or sneezing helps prevent the spread of virus-laden droplets. It's also essential to avoid close contact with infected individuals, especially during their contagious period. Section 4. When chickenpox is contagious. Chickenpox is most contagious from 1 to 2 days before the rash appears until all blisters have crusted over. This period can last about a week or more. It's vital to avoid spreading the virus to infants, pregnant women, and those with weakened immune systems. Stay home to minimize transmission risk. Inform close contacts so they can monitor for symptoms. Complications can include bacterial skin infections, pneumonia, and encephalitis. Section 5. Shielding yourself and others from chickenpox. Preventing chickenpox is far more desirable than dealing with its uncomfortable symptoms and potential complications. Vaccination stands as the cornerstone of chickenpox prevention. The chickenpox vaccine is highly effective in preventing the disease. The vaccine is typically given in 2 doses, the first between 12 and 15 months of age and the second between 4 and 6 years of age. The vaccine works by introducing a weakened form of the Varicella-zoster virus into the body. This allows the immune system to develop antibodies against the virus without causing the actual disease. These antibodies provide long-lasting immunity against chickenpox. For individuals who have not been vaccinated and are exposed to chickenpox, there is a Varicella-zoster immune globulin, or VZIG. VZIG contains antibodies against the Varicella-zoster virus and can help prevent or lessen the severity of chickenpox if given within a few days of exposure. However, VZIG is not a substitute for vaccination. Section 6. Managing chickenpox treatment and relief. While there is no cure for chickenpox, treatment focuses on relieving symptoms and preventing complications. Over-the-counter medications like acetaminophen or ibuprofen can reduce fever and pain. Never give aspirin to children with chickenpox due to the risk of Raynaud's syndrome. Cool compresses and lukewarm baths can soothe itchy skin. Antiviral medications may be prescribed for those at risk of complications. Consult a healthcare professional for proper diagnosis and treatment.